Hello guys, welcome back to my channel Religiously Fit. I hope everyone is doing fine and keeping safe. So today what we'll be doing is we'll be starting chapter 7. That is the most important chapter that I've already mentioned in my last videos. So the name of chapter is Functional Assessment, Posture, Movement, Core, Balance and Flexibility. So as the name suggests, we'll be covering all these concepts in this chapter. We'll be mostly doing the assessment part, the checking the deviations, doing some movement screening and okay, so all these things: posture, movement, core, balance, and flexibility. So I'll start the chapter now. First thing what we are going to cover is static postural assessment. So we'll be checking the we'll be doing an assessment of static posture, okay, without moving. So first part is structural integrity, the state of musculoskeletal alignment and balance that shows muscle, joints, and nerve to function efficiently, which means we will be checking the structural integrity of our body. Second is kyphosis, lordosis, muscle imbalances, which I mentioned in the glossary video or my last video. And what is kyphosis? The rounding of the upper back. What is lordosis? Rounding of the lower back, lumbar spine. And this video involves a lot of demos. So I'll try to give a lot of as many demos as possible. Otherwise, I'll tell you the table number where you can refer the table, the diagrams. Okay, so in this static postural assessment, we'll be talking like what are the muscles which will be tight and what are the muscles which are weak because of which that respective posture is happening. Okay, so for kyphosis, lordosis, muscle imbalances, the muscle which are tight are called shortened, the muscle which are weak are called lengthened. Okay, remember these words. So shortened is hip flexors. Okay, so I'll try to tell you a little bit about this. Hip flexor are these muscles which start from the pelvic region and goes downwards. So when hip flexor, lumbar extensor, anterior chest. Okay, this anterior is the front part, posterior is the back part. Anterior chest, anterior shoulders, that is these deltoids. Latissimus dorsi, that is this muscle which starts from here and goes straight downwards, and neck extensor. Okay, neck extensor. So when these muscles are tight, so this kind of deviation happens. This upper back, this thoracic part, the upper back becomes rounded. Okay, and when this part, the lumbar back, the lower back becomes excessively arched, as you can see, is now excessively arched. Okay, this is called lordosis. So guys, you have to remember these names because like if you can try spending some time getting habituated with these names. Otherwise, I would suggest that try to remember these names as much as possible so that it becomes easy for you to remember during exam. So for kyphosis, the tight muscles will be hip flexor, lumbar extensor, anterior chest and shoulder, latissimus dorsi, neck extensor. Okay, and the muscles which are weak, which are lengthened, which are inhibited, these are the synonyms: lengthened, weak, inhibited or inhibitors. So these will be hip extensor, external obliques, upper back extensor, scapular stabilizer, neck flexors. Okay. So because these neck flexors, the scapular stabilizer are weak, upper back extensor, external obliques, hip extensor, these are weak, because of which this conditions happen. The rounding of the upper back happens, which is called kyphosis. So okay, so there was a new name, scapular stabilizer. Okay, what is scapula? This is scapula. These two blades, this side and this side, the blades, your shoulder blades, which are called. Okay, so for these blades to become stable, that so that they can rest against our back, there are a couple of muscles because of which these scapular blades, they function. So these muscles, the group of these muscles are called scapular stabilizer, which includes trapezius, this muscle, trapezius, serratus anterior, this muscle, which joins this part and the anterior part, these wings like part. Okay, rhomboids, which are in the middle of the upper middle part of your back, levator scapulae, and latissimus dorsi. So latissimus dorsi is your wings, which we call wings. So these 1, 2, 3, 4, 5, these 5 muscles constitute scapular stabilizer. Try to remember this. This is very important. So now coming to the second postural assessment, second imbalance, which is flat back muscle. So again, there will be some shortened muscle, some lengthened muscle, because of which this imbalance is happening. Some muscles are tight, some muscles are weak. Because of this, flat back imbalance is there. Third is sway back imbalance. Fourth is muscle imbalances. For this back, only 3 types of imbalances are there. First is kyphosis, lordosis, muscle imbalance. Second is flat back muscle. Third is sway back muscle. Okay, so you have to refer the diagrams for this so that you will be able to understand, like as I explained for kyphosis and lordosis. There will be diagrams for flat back and sway muscles. So you have to refer those diagrams and you have to remember which muscles are tight and which muscles are weak, which are like okay. So to understand the imbalances. Okay, coming to the type of muscle imbalance, one is correctable, one is non-correctable. Correctable is something which obviously we can correct with the training and doing stretching exercises. So correctable is repetitive movements, habitually poor posture, side dominance, lack of joint stability and mobility, imbalanced strength programs, because of which the imbalance has happened, which we can correct with in the course of time. Non-correctable is congenital condition like scoliosis. Scoliosis is like, this is your spine, and your spine is, your spine is in a sway condition, it's an imbalance condition. So that is something which we cannot correct. That's a medical condition. So that is also called congenital condition. So like structural deviation, if your body has some structural bone deviations, certain trauma conditions like surgery or amputation. So these are non-correctable. We cannot correct them with exercises or strengthening or stretching. Okay, now coming to the deviation, which is the most important part of this chapter. There are several kinds of deviation. I'll be going through one by one with them. So first deviation is ankle deviation, second is hip deviation, third is pelvic deviation, fourth is shoulder deviation, fifth is head deviation. So first is ankle deviation, ankle pronation or supination. This is a very, very important concept. Pronation and supination, you have to memorize this thing. First you have to understand, and then if you are still getting confused with pronation and supination, then in that case you have to memorize them for the exam at least. So okay, I'll try to show my knee. Okay, I'll try. So this is my leg. I'll move the phone. Okay, so if my leg is like this, is a normal condition of my leg. If this knee is inward, getting into this direction, like this is normal and this is like inward, I'm not able to do that because my knee is not in the inward. But if it is going in this direction, that is called pronation. And if this leg is getting into the outward direction like this, okay, this is like exaggerated form. It's not like that, but kind of, my knee is going protruding outside, then that is called pronation, and that is called supination. Okay, so, and this supination, when your knee is like getting in the outward direction, okay, like this, that is called supination, which is also called inversion. Okay, like this is your foot and it's like this, so this is like coming inside. Okay, the knee is getting outside but the foot is getting inside like this. So this is called inversion. And when your knee is getting into the inward direction like this, okay, your leg is tilted inward slightly, that is called eversion. Eversion, inversion. Eversion is pronation and inversion is supination. Sorry. Okay. Now we are moving to pronation, eversion, femoral movement. Okay, so pronation is inward and supination is outward. Then foot movement, eversion, I have already told. Tibia. Okay, so this is bone is called tibia and this is called femur. This is the quads. Okay, quad muscle which is supported on the femur. So when the tibia is moving, like this is the tibia. So when this supination is happening, knee is going outward. Okay, so tibia is moving inward, and when then foot is moving inwards, that is pronation. Tibia is moving outward. So you have to understand that when the foot is going inward and outward, so how the tibia and femur are reacting to those situations. And in the while we were doing this, while you were viewing my foot, so you were viewing in the frontal plane. So frontal plane is what? When the body is divided into two parts, front and back. Okay, any movement that you are seeing from the front side. Okay, like right now I'm doing any kind of exercise, so which can be seen from the front or the back. The second is the sagittal plane. When the body is divided into like this half, left and right. Okay, so that is called sagittal plane. Like for example, I'm doing a bicep curl, so you will be watching from this side, so that will be the sagittal plane. And third is transverse plane, when the body is divided into top and bottom. Okay, when something is moving around the joint, like we do tricep supine in triceps in supine position. Okay, now supination is also done. Supination is also done. Okay, now the second deviation is hip deviation. So hip adduction. Adduction, as I told in the glossary video, adduction is something when the movement is done towards the midline of the body. This is the midline of the body. When any movement is done towards the midline, and when anything is done away from the midline of the body, that is called abduction or abduction. Okay, so hip adduction, lateral tilt of pelvis elevates one hip. Okay, so like this is my pelvic region, this is my pelvic region. Okay, so when hip adduction is something like the pelvis is tilted in like one direction. Okay, is slightly upward from this direction, slightly downward from this direction, or slightly upward from this. Like I'm right now exaggerating the movement. It is not like this much movement, but slight upward or downward from one side. So that is called hip adduction. Okay, so third deviation is called pelvic tilting, which is again the like similar thing. Anterior pelvic tilt or posterior pelvic tilt. Like this is the pelvic region. Okay, this is the pelvic bone. So anterior pelvic tilt means it is going to be lean forward, and pelvic means posterior means it will be going to lean backward. So consider this pelvis area as a kind of bucket which is filled with water. Okay, so when there will be anterior pelvic tilt, like this pelvic region is going to tilt in the front direction. Okay, outward. So this bucket is filled with water, and now when see, I am standing straight, pelvic is in the normal position. Like now the pelvic kind of slightly tilted in the forward position. So if there is a water filled bucket, so water will be falling from the front direction, and if it is moving in the backward direction, this pelvis is tilted backward. Like okay, your ass is inside. Now if it is tilting from front, your ass is like outside. This is again an exaggerated movement. This much is not done. This much deviation is not present in anyone. But if it is like pulled from the front side, that is called anterior pelvic tilt. Water will be flowing from front side, and if it is a pelvic tilt, water will be flowing from the back side. So this is just a visualization concept, so that you will be able to understand what is anterior pelvic tilt and what is a posterior pelvic tilt. Okay. So when there is an anterior pelvic tilt, the muscle which will be affected are tight hip flexors. Okay, because if this pelvic region is tilted in the front side, so obviously these muscles, the hip flexors muscle, are pulling it in this direction. So that is why the pelvis is not able to sit in the normal position. It is kind of tilted in the front direction because these muscles are tight. This can happen because of sedentary lifestyle, people like who don't do exercise and all, or people who do a sitting job. So their hip flexor are normally become shortened, becomes tight because of this. Their pelvic is tilted in the front direction, so their ass is basically inside. Okay, so and when there is an anterior pelvic tilt, the ass is pushed into inside. Okay, it's a synced ass, it's went inside kind of thing. And when there's a posterior pelvic tilt, like okay, this is the posterior pelvic tilt, you can see from this is normal position, and now the ST is tilted in the posterior, like it's in the going in the backward direction. Okay, so when there is a posterior pelvic tilt is superior posterior portion of pelvis rotates downward and backwards. So this pelvis is like these are your glutes or your hips. Okay, this is the muscle on the posterior part of the pelvis. This is going backward and downwards. Okay, so your ass is sinking in, it's going inside. Okay, and when there's a tilt on the front side, that is the anterior side, your pelvis is going tilted from the front side, your ass is going out. Okay, no, this is just a way to remember thing. Now number 4 deviation is shoulder position. So there can be 6 type of movements associated with shoulder. One is elevation, okay, like this is elevation. Next is depression. Your shoulders are depressed, okay. Then the adduction, okay, like adduction is this. Your shoulders are this, like getting towards the midline. Okay, this is abduction. Your shoulders are going away from the midline. Okay, adduction, okay, adduction, abduction, okay, and upward rotation, like you are doing the shoulder press. Upward rotation, your scapula is going in the upward direction, and downward rotation, like this, your scapula. These two things which you can feel, like you can put your arm at the back and you can feel there's some kind of plate, two plates on the left hand side, on the right hand side. Those are called scapula. Scapula going downward. Okay, so what will be the muscle which will be tightened in this case? So shoulder not level. My both shoulders are right now level, at the same level. But for example, if my shoulders are like this or like this, okay, that means my shoulders are not leveled. So when shoulders are not leveled, tight upper trapezius, for example, this thing is tight, okay, this right trapezius is tight, okay, or the left trapezius is tight, because of which the shoulder can be in this position. And levator scapula and rhomboid, all three muscles, if they are tight, so this conditions happens, okay. Rhomboid is the upper middle back muscle. Rhomboids, asymmetry to the midline. Okay, now this I won't be able to show you because it's really tough. You can refer the diagram for this. Asymmetry to midline, and this is because there is tightness in the lateral trunk flexor, that is flex sides. The I won't be able to tell you, I'm sorry for that, but you have to refer the diagram for this. Protracted shoulder, like forward, and rounded shoulder, as I told you in the abduction. Forward, this is normal position, this is forward position, and rounded. So you can see the scapula is going in the outward direction. You are feeling stretch from the back. Okay, that is called protracted shoulder, forward and rounded. This is because your serratus anterior, these muscles which are connecting your back to the front, these muscles, serratus anterior and anterior scapulohumeral muscle. What is scapulohumeral? Where the scapula, this scapular plate, and humerus, this bone, they are joined. So when there's a tightness in anterior part, anterior means front part of the scapulohumeral muscle and upper trapezius, the upper traps are tight, scapulohumeral muscle is tight, and serratus anterior is tight. So then this thing happens. If you do this thing right now, you'll be able to feel this muscle is tight, there's a tightness in this muscle and this muscle. Okay, so because of which protracted shoulders happen. Medially rotated humerus. Okay, now if you have around this shoulder, if you have round shoulders, your hand will always be in this position. You can see my hands are like this. Okay, and if your shoulders are like normal, so your hand will automatically be in this position. You can try to do that. Like put your shoulder in normal position, your hands will be like this, and put your shoulders in front, like rounded form. Your hands will automatically be positioned like this. So that is called medially rotated humerus. Humerus is this bone. So when it is medially rotated, like it is rotated from this side, so obviously the hand will be moving. Okay, this is a normal position, and if it is medially rotated, see, this is position number 1, this is position number 2. Okay, so when this is medially rotated, your pectoralis major, what is this? Pectoralis major, pecs, this is tight. Okay, and latissimus dorsi, that is shoulder adductors, latissimus dorsi, which also works as shoulder adductors, adductors, and subscapularis. Subscapularis, I'll tell you in detail in the coming video. Okay, now the fifth observation in shoulder is kyphosis, depressed chest. Kyphosis, what was kyphosis? Okay, depressed chest. So obviously the chest is depressed, it will be in the depressed position. Shoulder adductors are tight, latissimus dorsi, pectoralis minor, which will be here, rectus abdominis, that is this, and internal obliques, which are these muscles. So when these muscles are tight, kyphosis and depressed chest happen. Okay, so now moving to deviation 5, which is head position. Okay, so you will be viewing me in the sagittal view, that is from this side. Okay, because forward head, if my head is like this, you won't be able to see from the front or from the back. It would be great if you see this thing from the this side, sagittal plane. Okay, then you'll be able to understand, okay, how much forwarded is my head is. So this is a kind of deviation which I also suffer from. I have a forward head. Okay, like it should be normal position is this, but this is like this. Okay, so when there does this happen? When we have tight cervical spine extensor, upper trapezius is tight, and levator scapula is also tight. Okay, so these all deviations can be fixed with the help of training and proper stretching exercises over the course of time. Okay, now coming to the second part, that is called movement screening. So there are 5 primary movements. First is bending and raising, lifting and lowering, that is also called squatting. Second is single leg movements, that is also called lunges. Third is pushing movement in vertical or horizontal planes. Fourth is pulling movement. Fifth is rotational movement. Okay, so these are the 5 primary movement screens in which, with respect to which, you can identify a postural deviation. Okay, now comes second, bend and lift. So there will be compensation. Compensation is like when posture is compromised. Posture is compromised and it is not in the normal state. It is called compensation. So how you will be able to know that? Like first we will be talking about bend and lift, which is also called squatting. So we will be talking about the compensation involved in bending, that is squatting. First is anterior view, that is the front view. Posterior is the back view. I'm again and again saying these words so that they get into your memory and you don't find any difficulty while reading these names. Okay, so while understanding squats, while understanding the compensations in squats, we'll be seeing the postures from frontal view, from sagittal view. Okay, sagittal is this side, frontal is front or back. So when you're doing a squat, I'll try to do a little demo. I don't know how much will I be able to, tell, but okay. So when I'm doing a squat, the knees should be, they should not cave in or they should not move in the outward direction. So if the knees, like if I'm doing a squat, the squatting position has to initiate from the glutes, not from the knees. While starting these squats, if the knees are going in the outward direction, then that means you have tight hip flexors and tight quads, okay, and weak gluteus maximus. That is your, in layman's language, that is called hips, okay. So if the knees are caving in while doing a squat, they are caving in, then that means you have overactive overactive means tight hip adductors, adductors. And if and at the same time, which muscles are weak, because of which the knees are caving in, they are not able to hold nice and tight, but they are caving in because we have weak gluteus maximus and medius. Okay. Second is sagittal view, movement initiated at knees. As I said, if the movement is in squats, if the movement is starting at the knee, like while doing a squat, and if this is happening, okay, the knees are going outward and the glutes are not moving, okay, and that means these muscles are tight, that is hip flexor and quadriceps, and insufficient activation of glutes group, that means glute groups is this is weak muscle. Sagittal view, back excessively arching, that is lumbar and thoracic spine view, okay, like while doing squat, see this back, this is arching too much, okay. So then that means tight hip flexors, tight back extensors, and tight latissimus dorsi. Because of this, extensive arching is happening in my lumbar back, in my lower back. So, and what is weak? Underactive core. The core is weak. Rectus abdominis, gluteal group, and hamstring. So when I'm doing a squat and this thing is overarching, okay, now you'll be able to see. This is overarching. So that means these muscles are weak. Hamstrings are weak. Rectus abdominis is weak, and glutes are weak. Okay. And what is tight? Hip flexors, back extensor and latissimus dorsi. Now comes 4, sagittal view, back rounds forward. Okay, then again you have to remember these things. When your back is rounding forward, then tight latissimus dorsi, tight teres major, pectoralis major and minor, and underactive upper back extensor. So, okay, so here comes, we are done with the back. The video is already 25 minutes, okay. Now come hurdle step. Hurdle step, we'll be checking the compensation involved in hurdle step. Remember, we are talking about 5 primary movements: bending and raising, lifting and lowering, which is also called squatting, single leg movement, pushing movement, pulling movement, rotational movement. There are 5 movement screen. You have to remember this. There are 5 movement screen. So first we talked about bend and lift, the compensation involved in bend and lift. Now we'll be talking about the single leg movement, the compensation involved with the single leg movement. Then we'll be talking about the pushing movement compensation, pulling movement compensation, and rotational movements compensation. So now come hurdle step. You have to refer table 7-10 for this, because I won't be able to explain it very well. You have to refer to the table so that you will get a full understanding of this thing. So when we are talking about the compensation, anterior view, we are talking about the anterior view, like you are watching from the front side. Stance hip rotation, stance leg. This is normal position, this is stance position. Okay, when one leg is in the front and one leg at the back. So tight stance leg or raised leg, internal rotators, underactive stance leg or raised leg, external rotators. You see, guys, you have to remember these things, because I know when I was studying and preparing for ACE exam, it was not that easy to remember everything, like to understand everything. So what I also did was I tried to remember certain things. So I would recommend you to go to certain other YouTube channels which are very good at explaining the human anatomy, and you'll be able to understand when certain movements are happening, which muscles are tight and which muscles are weak. Like for example, if you are doing a chest press, okay, then try to visualize while doing a chest press which muscles are tight and which muscles are weak. Okay, so you'll be able to understand, you'll be able to get a basic understanding that whenever some movement is being performed, so which muscles are involved in those movements, which are helping, which are not helping. Okay, so likewise you will be able to understand this tight muscle and weak muscle over a course of time. Okay, so don't worry, you will be able to get it. Just try to spend some time on other YouTube channels which are good at explaining human muscle anatomy. Okay, now coming to the shoulder push stabilization. So compensation involved with the pushing movement is sagittal view, winging during the push-up movement at scapulothoracic joint. What is winging? These are the shoulder blades when they are winged position, like they are coming slightly outward. Okay, like you might have seen in some people, like mine is getting merged with the back, but for some people they are kind of getting outward from the thoracic cage. This is the thoracic cage, which is constituted of the ribs. So the scapular plates are coming a little outward of the thoracic cavity. So the compensation is when you will be seeing in the sagittal view, like I'm doing a press, like a push-up, winging during the push-up movement at scapulothoracic joint. What is a scapulothoracic joint? The joint where the scapular blades and the thoracic cavity are linked together. That is called, this is the thoracic cavity, this is the thoracic cavity, and this is the scapula. Okay, where they are joined together, that is called scapulothoracic joint. Okay, and why this thing is happening? Because there will be certain muscle group which are weak, and because of which the winging is happening. The scapular plate is coming a little outward of the thoracic cage, sorry. So those muscles which are weak, because of which this unstabilization is happening, that group of muscle is called parascapular muscles, which are serratus anterior, this muscle, the trapezius, the levator scapula, the rhomboids. Okay, they are unable to stabilize the scapula against your rib cage. Okay, so because of this, scapular winging happens. Now comes to the thoracic spine mobility. The compensation involved in thoracic spine mobility, that is table 7-12. We'll be seeing in the transverse view, that is the third view which we were talking about, possible side dominance, possible differences in paraspinal development, possible torso rotation, possible associated with some hip rotation. So because of which thoracic spine mobility compensation happens. Okay guys, so we'll be now talking about the assessing flexibility and muscle length. Okay, assessing flexibility, how much flexible are your joints and muscles are, and their length. So first is Thomas test. Thomas test, again you have to refer a figure for that. The person who is going to be assessed has to lie flat on a table with both legs falling on the ground, like falling off the table, and they have to. I'll just try to do a small demo so that you get some idea about this Thomas test. So while lying supine means your back is resting against the floor, the table or whatever that object is, and then you hold your this leg against your chest. Okay, so you are lying on a table. Try to visualize that, or try to open the book chapter 7 for this figure. And when you are lying on the table with one leg falling off the table and second leg close to your chest, then what assessment has to be done is the other leg which is falling off the table, the hamstring has to touch the table, and the falling part of the leg, that is shin or the tibia, it has to form around an 80-degree angle with the table. So if that thing is happening, if the posture looks like this, then that means your hamstring is good, the length of the hamstrings are good, there is no tightness in the quads. So this test is performed to check the hip flexion or quads length. Second is passive leg raise. Passive leg raise is you are again lying flat on the ground, supine position, your back against the floor. So you have to like this is the supine position, like you are lying flat on the ground. You have to raise one of your leg. Okay, not this one. Raise one of your leg like this, and if this leg, the raised leg, is forming around 80 degree of angle with your body, then that means your length of the hamstring is normal, at least 80 degree of flexion before pelvis rotates. The pelvis doesn't have to rotate. Okay, your lower back has also to, your lower back has to touch the ground. It doesn't have to rotate. There shouldn't be any arching in the lower back, and with that your leg is going in the upward direction around 80 degree angle. Then that means the hamstring are good. They are not tight, and the length is also fine. Third is shoulder mobility, flexion or extension. The shoulder are flexed at a 170 or 180 degree, like this. Okay, like from the downward position to this position, 170 to 180 degree angle. That means good shoulder mobility. Now the internal and external rotations of shoulder. This is internal rotation. This is external rotation. Okay, this is external rotation. Okay. Shoulder test, Apley's scratch test for shoulder mobility. Now you take your right hand, try to touch your left scapula, okay, and take your left hand, try to touch your right scapula, okay. Yeah, oh, sorry, my shoulder position was not right. It has to rest downward, easy, comfortable, and you try to touch your right scapula, and now this one easy downward, try to touch your left scapula. And to touch those points, the personal trainer has to mark those areas so that we can measure that right and left hands are touching at the equal level on both the scapulas or not. If there's any difference, then that means that there's some muscle tightness in your shoulder, in your rotators. Okay, now comes to the last part of this chapter, balance and core. For checking the balance, we will be performing some tests. The first is called Sharpened Romberg test. So what does this test do is, this is for assessment of a static posture. Okay, assess static posture by standing with a reduced base of support and eyes closed. Okay, so what you have to do is, like you are standing normal straight, then in a stance position like this with eyes closed, and you have to maintain your balance with your eyes closed. So this will tell the personal trainer that you have a good static posture. Now legs in this position, staggered in stance, eyes closed. Okay, or there can be tests like this. You put your leg like this, stand straight, and the other one. Okay. That means my core is not that strong. Okay, now stand like this, and then your pelvis is not should not be treated like this or that. Okay, it should be straight. The body should be straight. Or if you're doing like this, okay, they shouldn't be like this, or they shouldn't be like this. If this movement is happening, like your body is not be able to straight, it's moving like, and that probably means your hip abductors are weak. Okay, abductors. Okay. So Sharpened Romberg test, stock stand balance test, which I just now showed you on standing by on 1 foot in a modified stock stand position. Third is Megal torso muscular endurance test. So Megal torso battery, it is also called battery test. So Megal torso test is done for checking the strength of the core. This Megal torso test comes in 3 variants. First is trunk flexor endurance test. Second is trunk lateral endurance test. Third is trunk extensor endurance test. So again, you for this, I would recommend you to watch the diagram and along with that some YouTube videos so that you will be able to get proper understanding what these tests are. Trunk flexor endurance test is you are flexing your trunk. You are sitting in this position, okay, without any support. You can put your hands like this or this. So your body is in the flex position. It is checking your endurance. Then trunk lateral endurance test, you are like a side plank, okay, like a side plank thing. That is for checking the lateral endurance of your core. Third is trunk extensor. Extensor is you are lying on a table or something like that, and half of your body is off the table, and then you are doing like we do a hyper extension in gym. So there are some contraindications to all these three. Contraindications mean the things which you don't have to do, which you have to avoid. Like the people, like if I talk about the flexor test, when you are sitting in this position without a support of the back, you shouldn't recommend this test to people. You shouldn't be doing assessment on the people which have lower back pain or have had serious or recent back surgery or in any kind of acute lower back flare up. So, the trunk endurance, lateral endurance test, that is I saw this side plank, not good for people who have shoulder pain or weakness, may not be suitable for those suffering from lower back pain, had recent again back injury and same thing. Trunk extensor endurance test may not be suitable for those with major strength deficiencies. Individual cannot even lift the torso from a forward flex position to a neutral position. Remember this, very important. Client with high body mass, lower back pain, recent back surgery, acute lower back problem. So here comes the end of this chapter. And so see guys, the most important thing while doing assessments and everything is that you should clearly understand what all exercises and assessments or all those things you should not avoid. Okay, this is very important with respect to the exam, because the exam they ask you what you shouldn't be doing this with this particular kind of client. Okay, so ACE put a lot of serious concern on that area, that what exercises and what assessment you should avoid. So try to remember, wherever avoid word comes, try to remember that thing very well, because in an exam they might be asking you questions around that thing. Okay, so I hope this video was useful to you. If in case you have, obviously you might be having a lot of questions and concerns, so you can drop in your questions on my Instagram. I also live there with the same name, religiously fit, or otherwise in the comment section. And please do subscribe and like and comment on my videos. Okay, thank you so much for watching. Bye bye.